Welcome to our presentation. Today we will be talking about how we are going to tackle childhood obesity in London. So in order to explain how we're going to do it, we're going to divide our presentation into three parts. Firstly, we will present the current situation. Secondly, we will explain our solution. And finally, we will talk about the impacts and the challenge that we have to take into consideration. So, who are we? We are the Department of Health, the governmental organization that oversees the NHS, and we focus on adult and child health policies. In the field of obesity, the job we want to do is tackle childhood obesity in London, which makes our scope the 1.5 million obese children within the age between 2 and 15 years old. So we decided to focus our attention on childhood obesity in London as during our research we discovered that if 70% of obese children continue to be obese in adulthood, it will cost 110.8 million pounds a year to the London economy. More specifically, we will be targeting the children between reception and year 6, since we found that obesity prevalence almost doubles between reception and year 6. As we were focusing on London boroughs, we found that the borough of Hackney is above the London average of childhood obesity as well as the England average. So the idea actually is to make a trial in the borough of Hackney, so using our Hackney project as a pilot project, and then once we will be able to see the benefits of our pilot project, we will be expanding the project on London. All right, and as it is a pilot project, we decided to compare it with another borough in London called Lewisham. As we can see that the Hackney and Lewisham have similar obesity levels in their areas. Okay, so we will carry out our trial in the borough of Hackney, and what we will be looking at in particular at Hackney would be treating the scrutiny Hackney faced regarding the lack of activity and active travel. So we realized that to treat obesity, we need to consider both physical activity as well as healthy nutritional habits, but we decided to focus on physical activity for our pilot project.
Our main objective will be to make children more active and spend less time sitting, which will be done by increasing specific behavior intensities as well as implement new behavior by using upcoming technology of wearable. So what is out there in the market right now? We have Zamzi and Cowdit. The similarity with them and our venture is the fact that our objective is to encourage people to be more active and less sitting. Another similarity is the reward system to encourage people to be more active. And the main difference are that we have different target groups, while Zamzi focus on children aged from 9 to 15 and Cowdit available for people with age over 13. Our venture will focus on children aged between 4 to 5. Another important difference is the subscription models. Both Zamzi and our program will be free to use, while Cowdit require you to pay $9 per month to access to some special features such as goal setting. So what can we learn from Cowdit and Zamzi? We focus that the reward system. Now for Zamzi is very interesting. They offer both instantaneous and long-term reward for kids and parents, and the trigger used to keep kids stay involved. For example, they have double point days, or children be able to accumulate their points to get a bigger goals, to get a bigger prize, such as an Xbox One. And the third point we want to learn from them is they allow parents to set goal and price by the parents. So what we learn from Cowdit is that they offer both mobile and computer platforms, so it's make things easier for people to access, and they allow their system to work with multiple devices such from Misfits, Fitbit, and Jawbones.
So we applied these insights into our practice. Our plan of action will be providing children in Hackney with the ages 4 to 5 with healthcare variables. Specifically, we will be providing Misfit Flash, a waterproof, non-rechargeable activity and sleep tracker. We will use this to track their activity and sleep, set goals, for example, walk 1 mile a day, and reward them for it. As a whole, this is what our operation would look like. We supply the children with Misfit Flash. All the data collected will be synced into the online platform, which will be the school system as well as the parents' phones, so we cover both the web and online platform. The data also has an uplink to both the Misfit Cloud and our cloud, and we will analyze the data to provide them with relevant rewards, which is which is calculated using a specific algorithm. So who could we partner up to sponsor our reward system? Currently, Amazon have been sponsoring Count It in the US market and therefore might be willing to do so in the UK market as well. Another possible partner could be Sainsbury, who already offer active vouchers for kids, so this will be right up their street. For the kids, receiving vouchers from Sports Direct could also encourage them to achieve their goals. So how does this look like in the day of the life of an average child we will call Lucy? As you can see, this is what Lucy's daily schedule looks like, which we adapted from a primary school schedule. And the red highlights all the times Lucy is sitting, and the green is the non-sitting. As we mentioned earlier, we want to change the behaviors, and we are separating them into new behaviors, shown by green, and increased behaviors, shown by purple. For example, rather than Lucy watching TV during breakfast, we will enforce a new behavior to change it into non-sitting time. Similarly, we will increase the non-sitting time during lunch, for example, so that Lucy exercises more and reaches her goals set. The impact on Lucy as an individual is as follows. The Sit Stand campaign found that in just an hour of standing, you can burn 30 to 60 calories, and if you apply this to the increased non-sitting time, Lucy stands to lose about 0.6 kilograms per month. Other impacts include enforcement of healthier habits at a young age that will remain with them until adulthood, as well as the ripple effect of sharing such habits with others, for example, their parents.
Let's now focus on the financial aspects of our venture. To give you an idea of the scope we are talking about, consider that the NHS budget in London only is £16 billion a year. The adult obesity treatment costs to the NHS in London are around £280 million, and the child obesity costs to the NHS in London are around £33 million a year. More specifically, we broke down the costs for our Hackney trial into non-recurring and recurring costs. The non-recurring costs include the equipment, which is the Misfit Flash in our case, with around £57,000 and shipping of £7,000, and also free data security system and online storage space. This gives a total of £64,000 as a one-off cost. Recurring costs include the free system maintenance and support, and a range of 10 to 15% calculated for the device replacement, which is equal to £6,000 to £9,000 a year. We also added labor costs for 2 employees earning the minimum wage, which amounts to £29,000 a year. This gives a total range of £35,000 to £38,000 per year. Regarding the impact on Hackney, the first best option would let the borough save around £60,000 a year. If child obesity could be reduced by 50% in the second best option, Hackney could save £30,000 a year. And this doesn't even include any sponsorship or partnering, and neither includes the long-term benefits of child obesity prevention, which was mentioned earlier. The benefits of scaling include reduced device and shipping costs, with Misfit and Royal Mail respectively, and operational benefits of economies of scale. In addition, complementary urban planning could support active children. This would include additional playgrounds and safe walkways, for example. Over the long term, this idea could also be scalable elsewhere.
There will be challenge, of course. The first two challenge directly related with the habit design, where we require the kids to put physical effort in, and the second challenge occurs when it can change the daily routine of the kids and their parents. The other challenge are in regard to privacy, since it's quite a sensitive subject about tracking children's activity and sleep data. And the other challenge is data ownership, since it is unclear who the data collected belong to, if it's whether it belongs to the children, the parents, misfit, or us. The current austerity measure and cut in NHS spending will also be a challenge when we trying to push these ideas forward. So we need people on our side. We need the public of Hackney, since the activities is only one part of this obesity challenge. We also need misfit to embark on this trial, and last, we need the parliaments to support us. Thank you for watching.